Hello, everyone, and welcome to a new episode Red Light Therapy. In this episode, we are going to discuss the red light. What is red light therapy? What are the uses of it, risks, benefits, and we will also discuss through the scientific publications. So, what is red light therapy? It is a treatment that uses low wavelength red light to reportedly improve the skin's appearance, such as reducing wrinkles, scars, redness, and acne. It's also touted to treat other medical conditions. The results of some studies do show some promise, but the full effectiveness of red light therapy has yet to be determined. Other names you might hear to describe red light therapy include like lower level laser red light therapy, low power laser therapy, non-thermal LED, soft laser therapy, cold laser therapy, biostimulation, phototonic stimulation, photobiomodulation, and phototherapy. Okay, so how does red light therapy supposedly work? So red light therapy is thought to work by acting on the power plant in your body cells called mitochondria. With more energy, other cells can do their work more efficiently, such as repairing skin, boosting new cell growth, and enhancing skin rejuvenation. More specifically, certain cells absorb light wavelengths and are stimulated to work. Okay, so red light therapy may work in skin health to like stimulate collagen production. This gives skin its structure, strength, and elasticity. It also increases fibroblast production, which makes collagen. And what? So collagen is a component of connective tissue that builds skin. It also increases blood circulation to the tissue. The red light exposure may produce a positive biochemical effect in the cells that strengthens the mitochondria, which is where the cell's energy is created. RLT may do this by increasing the transportation of electrons, oxygen consumption, and your levels of ATP or adenosine triphosphate. By increasing the energy of the mitochondria, cells may function more efficiently, as well as rejuvenate and repair themselves. So, according to 2013 research, the red light therapy increased blood flow, reduce inflammation, increase the production of fibroblast. Studies from the past 20 years suggest that RLT may help promote wound healing and tissue repair, reduce some cancer treatment side effects, such as oral mucositis, radiation dermatitis, and lymphedema, and improve hair growth in people with androgenic alopecia, treat carpal tunnel syndrome in the short term, reduce myopia progression, reduce neuropathic pain, improve neural function and protection to improve cognition and memory for people with Alzheimer's disease, improve skin complexion and build collagen to diminish wrinkles, relieve pain and inflammation in people with pain in the Achilles tendons. Okay. Researchers have known about red light therapy for a while. It may also help with dementia. In one small study, people with dementia who got regular near infrared light therapy on their heads and through their noses for 12 weeks had better memories, slept better, and were angry less often. Dental pain. In another small study, people with temporomandibular dysfunction syndrome, TMD, had less pain, clicking, and jaw tenderness after red light therapy. Okay, so like osteoarthritis. One study found red and infrared light therapy cut osteoarthritis related pain by more than 50%. Tendinitis, there was a very small study of 7 people that suggests that RLT lessens the inflammation and pain in people with Achilles tendinitis. Red light therapy also there has some specific supporting the potential applications include like scarring, which is also known as skin fibrosis, annually affects more than 100 million people worldwide. Through some clinical trials are needed, there is a growing body of evidence that red light therapy may help modulate key cell characteristics that contribute to scarring. In this case, red light therapy is used to reduce collagen production in scar tissue, improving or preventing thickening scars. Let's talk about hair growth. RLT has been shown to reduce the effects of androgenetic alopecia, the most common form of hair loss caused by genetic predisposition to an excessive reaction to androgens like testosterone anytime after puberty. By decreasing inflammation and increasing the blood flow and circulation to the scalp, it has the potential to bring more cell activity and nutrients to that area. Recent studies indicate that using red light therapy may promote increased hair thickness and density, but more research is needed. Red light therapy is also being used for the enhancement of fat loss. Though red light therapy is being advertised for fat and weight loss, the jury is still out on this one. However, there are a few studies showing that the application of red light may affect adipocytes, the cells that store fat. One older study published in the journal Obesity Surgery in 2011 found that when 40 adults with excess weight were regularly exposed to red light therapy, their adipocyte cells released triglycerides, resulting in fat loss. Participants in the study lost approximately 2.1 centimeters of girth over a 4-week period. That's like a month. Okay, so it's also used in the acceleration of sports recovery and injury prevention. Light can speed up the respiration process in cells and increase ATP and other mechanistic factors. You simulate cellular energy and you simulate the body's ability to repair by using the red light therapy. Okay, it's also promotion of brain health. Red light therapy may also help patients with Parkinson's disease manage their symptoms and sleep-wake cycles. Okay, so what are the red light therapy risks? RLT is cleared by the US Food and Drug Administration, known as FDA. It is considered very safe, though there is certainly an opportunity for user error if you are utilizing an at-home device. For example, it's possible to overuse the device or use it more frequently than is recommended by the manufacturer. The fortunate news is that many at-home devices have an automatic timer and shut-off, which makes it easier not to overdo it. Always follow the instructions and be aware that the Journal of Pain Review noted a risk of worsening migraine symptoms for some users. It's also important to check in with the appropriate doctor, for example, your dermatologist or PCP, to make them aware that the red light therapy is in your treatment plan. Finally, seek treatment from a reputable practitioner. Light can cause damage, but if the right protocol is used, you don't see any side effects. So I'm going to end the podcast over here. I hope you liked the episode. Please feel free to share with your friends and family. It really means to us. If you leave the comment down below, it'll take less than 30 seconds. It will help us to reach wider audience. I appreciate your time. Take care. Bye-bye.